Imagine sitting on a plane for hours. You finally stand up, and suddenly one leg feels swollen, hot, and painful. Most people would shrug it off, thinking it's just stiffness. But sometimes, it's a warning sign of something far more serious, a blood clot in your leg. Doctors call it deep vein thrombosis, or DVT. So, what exactly is DVT? Think of your veins like highways carrying blood back to your heart. Now imagine a traffic jam on that highway. A blood clot is like a roadblock, stopping the flow. That's what happens in DVT, usually in the deep veins of the leg, especially the calf or thigh. Why does this happen? There are 3 big reasons, almost like the perfect storm. First, not moving enough. If you're stuck in bed after surgery, recovering from illness, or just sitting still on a long flight, blood flow slows down. Second, damage to the vein wall. That can come from surgery, an injury, or sometimes a medical device. And third, sticky blood. Some people's blood is more likely to clot because of health conditions like cancer, pregnancy, or inherited clotting problems. Even certain medicines, like birth control pills, can make the blood thicker. When these 3 things come together, the chances of a clot go way up. But how do you know if you have one? That's the tricky part, sometimes you don't. Many clots are silent. But when symptoms do show, they usually happen in just one leg. You might notice swelling, pain, often in the calf, skin that feels warm or looks red, and sometimes veins near the surface that seem to bulge. You may have heard of an old test called Hohmann's sign, where pain shows up when you flex the ankle, but that there are also other tests. The real danger is what happens if the clot breaks free. It can travel up through the veins, into the lungs, and block blood flow there. That's called a pulmonary embolism, and it can cause sudden chest pain, shortness of breath, or even collapse. It's life-threatening. Even if the clot doesn't move, DVT can cause long-term problems like chronic swelling, pain, and skin damage in the leg. So if DVT is suspected, how do doctors check? First, they look at your symptoms and risk factors. They may use a scoring system to judge how likely it is you have a clot. Then comes a blood test called a D-dimer. If that test is normal, a clot is very unlikely. But the best way to know for sure is with an ultrasound scan of the leg. It's painless, quick, and shows the clot directly. What happens if you do have a clot? Treatment usually starts right away, because time matters. The main tool is medicine called anticoagulants, or blood thinners. These don't actually break the clot apart instantly, but they stop it from getting bigger and prevent new clots from forming. Over time, your own body will slowly dissolve the clot. Nowadays, most people get simple tablets called DOACs, medicines like rivaroxaban or apixaban. They're easy to take and don't usually need regular blood tests. Some people, like those with cancer or pregnant women, may get daily injections of a different type of blood thinner. There's also an older drug, warfarin, which is still used, but it needs frequent blood checks to make sure the dose is just right. How long do you take these medicines? Usually at least 3 months. If your clot was caused by something temporary, like surgery, you may stop after that. But if the clot happened without a clear reason, or if you still have risk factors, treatment may go on longer, sometimes even for life. In rare emergencies, if the clot is massive and threatens the leg itself, doctors may use stronger treatments. Clot-busting drugs can quickly dissolve it, though they carry risks. Sometimes surgery is needed to physically remove the clot. And if someone can't take blood thinners at all, doctors may place a small filter in the main vein of the belly, called the inferior vena cava, to catch clots before they reach the lungs. But this is only used in special cases. Of course, treatment isn't just about medicine. Everyday habits make a big difference too. Moving your body is one of the best ways to keep blood flowing. After surgery or illness, walking as soon as you can helps prevent clots. On long trips, stand up, stretch, or flex your ankles and calves. Drinking enough water is also important, because dehydration makes blood thicker. Elevating your legs when resting can improve circulation. Some people wear compression stockings, which gently squeeze the legs to keep blood moving, though not everyone needs them. In hospitals, if patients are too sick to move or can't take blood thinners, machines that gently pump the legs are sometimes used. And for people having major operations, Especially orthopedic surgeries like hip or knee replacements, doctors often give preventive blood thinners to stop clots before they even start. So, let's wrap it up. Deep vein thrombosis is simply a blood clot in a deep vein, most often in the leg. The warning signs are swelling, pain, redness, and warmth, usually on just one side. The danger is that a clot can travel to the lungs and cause a pulmonary embolism, a serious, sometimes fatal event. The good news is that DVT is treatable, and with quick action, most people recover well. Anticoagulants are the mainstay of treatment, supported by lifestyle steps like movement, hydration, and sometimes compression. The most important thing is awareness. If you ever notice sudden swelling or pain in one leg, especially after being still for a long time, don't wait. Get medical help right away. Knowing the signs and acting fast could save your life. Thanks for listening, and remember, keep moving, stay hydrated, and look after your veins.